So good morning, good afternoon, good evening to everyone here. I hope that you can hear me clearly. I do apologize if you may have a bit of a disconnection because here in Barbados, we're presently having a bit of a thunderstorm. So if you can hear me clearly, just give me a thumbs up. Thank you so much. So today, it is my pleasure to welcome each and every one of you to our webinar, The Future of Nursing in the Americas, Leading to Inspire and Unite. My name is Tracy Collins, and I am one of the Challengers Committee Hub Leads and a registered nurse from Barbados. I will be your main host for today, alongside my colleagues, Stephanie O'Neill, Emily Staley, Amy Harcasius, Abigail Weavers, who are all very outstanding nursing professionals. We are honored to be here with you, dedicated nurses, administrators, educators, policymakers, students, researchers, and advocates from across the region, each of us united by a common purpose to shape a stronger, more sustainable future for the nursing profession. We are also gathering at a defining moment in global health. As you know, the World Health Organization would have launched the updated State of the World's Nursing Report this morning. And it is a comprehensive review of where we stand as global nursing workforce and where we must go. Today's theme for the webinar, as I said before, Leading to Inspire and Unite, calls to action, to lead with courage, to inspire through innovation and care, and to unite across borders, institutions, and generations. So before we go ahead with our keynote speaker, I just wanted to take this time for you to think about one word about what the future of nursing means to you. Could it be equality, innovation, hope, leadership, investment? So let's take this moment to reflect on the diversity of the perspectives here in this space. You can utilize the chat box below, and at any point in time during the webinar, you can go ahead and leave your questions and answers, and we will have a segment later on where we can have your questions answered. So you can go ahead and utilize the chat box at this time using one word: empowering, hopeful. I totally agree. There is hope. Connecting, proud. And I can say I am proud to be here today with each and every one of you, taking time out of your busy schedules to be here with us to support the Americas region. Empowerment, inspirational. And those are some of the many words that too our early career nurses are using. So thank you so much for your contributions, role model. So we will now dive straight into our program. And I will now introduce to you our keynote speaker for this presentation, Dr. Bruna Moreno, consultant, human resources for health, Department of Health Systems and Service, PAHO/WHO, who will now provide us with our keynote speech. Dr. Bruna, over to you.
Thank you very much, Tracy, and everyone connect here, my distinguished colleagues, and all the attendees in this very special date celebrating the International Nurses Day. Let me share my presentation. Okay. So right now, I believe that you can see it. Regarding the situation of the nursing in the region of the Americas, as Tracy just mentioned, today was launched the State of Worst Nursing report that updates the situation of nursing all world. And we have some analysis regarding our region, the region of the Americas, in which we have 35 states, 35 countries. So for the region, we have 7.4 million of nursing personnel. And this personnel, this 7.4 million of professionals represents 63% of all health workforce. So we are the main category occupation in the health workforce. Then when we look at the countries, when we look at the data, we can see that there is inequity. Sorry that this is in Spanish, but there is an inequity in the distribution and the availability of the nursing professionals between the countries and sometimes into the countries. So internally, sometimes we have this inequity in the distribution, the availability of these professionals. And for all the 34 countries in the region, we have 40% of them with a density less than 30 nurses per 10,000 population. So this is critical situation since for these countries, we don't have enough professionals to care to the health needs that we have in the region. And also this shortage of professionals impacts in a negative way the quality of care and the opportunity to better care of the population. This density, as you can see in the map, is is mainly the Latin America countries, is mainly in the low and middle income countries. So for these countries, the shortage is worse than for the high income countries. Then when we look at the demographics data, we have that the region has mainly the female professionals. 87% of all the professionals are women. And it is like an issue since we have gender inequalities in health sector. These inequalities are regarding the wages, the opportunities, the leadership positions, the health, the benefits, the labor benefits, and so on. And also, when we see the graph regarding the age, we have 60% of all the nursing workforce under 45 years old. However, we have 19% of all this personnel that are over 55 years old. So this represents that this people will retire, probably will retire in the next 10 years. So when you have this shortage, this actual shortage, and we will have some people retiring next years, and also we'll see the situation regarding education. We have these factors that impact it in a negative way in order to have a sustainable workforce. So when we see the education data, we have for all the region, we have more than 2,000 schools of nursing. However, most of them, 83% of the schools of nursing are just in two countries that are Brazil and the USA. And these two countries represent just 53% of all the population of the region. And also, when we look at the doctoral programs in the Latin America, most of them, 65% of all of them are just in Brazil. So this limits the capacity of training new faculty members, training new professionals. So this is a big issue that we have in terms of training more and a new generation of nurses for the region. Also, information that it's important to highlight is that for our region, we have just 44% of all the countries with standards of interprofessional education. And there are evidence regarding the interprofessional practice and collaborative practice that improve health outcomes. So we are looking for have more interprofessional education for all the countries in the region, and this will impact in the service delivery in order to have better results. So regarding the working conditions, as you can see, we have here several indicators regarding working hours, the promotion of safety of the health workforce, the prevention of attacks, the mechanisms to retain staff in rural areas, and also the programs of well-being and mental health. When we look at this data, we can see that the nursing personnel in the region are at risk, are facing bad working conditions. So we need to invest in working conditions. We need to have better working conditions. We need to have mental health and well-being programs for all the health personnel. We need to regulate their practice in order they can have fair wage. They have adequate working conditions, working hours. So we are counting on this in order to retain the health workforce that we have now in the labor market. And then we have the APN role and the leadership indicators. For all the countries in the region, we have 64% of the countries that have adopted in some way the expanded role of registered nurses. We know that for the North America countries, this role is well established, but for the Latin America countries, we have countries in different situations and different scope of practice. And then we do believe that investing in APN roles is an important way to deliver better care, in order to that population can have access to a qualified nurse, and a nurse who can act with autonomy, with better education, and can improve the health results. And then another important data is regarding the government chief nursing officers. We have 86% of all the countries reporting that they have a GCNO or a equivalent senior leader position. And this is important. We do need these CNOs. We do need nurses in leadership positions. However, we need that these people, these leadership positions have all the conditions, all the resources, all the autonomy in order to help to support the development of policies, in order to offer better conditions for nurses to work in the workforce planning and policies. So we need to improve the role and the responsibilities of these CNOs in the region. And the last one, 71% of the countries has a leadership development program. it's important because we do need to develop the leadership skills, all the competencies to be in this position and to act in a proper way. Then we have the PAHO response. We have the policy on the health workforce at 2030. And also we have this technical document, this policy brief on the investment in nursing workforce in the region. Both of them are available in Spanish and also in English and Portuguese as well. These are important documents, resources in order to identify our recommendations, our strategic lines to different stakeholders in order to strengthen the nursing workforce in the region. As we mentioned before, today was launched the report, the State of Words Nursing Report 2025. And this report summarizes all the or all the key indicators for all the region. And also it's available the country profile that is a resource for each country to identify and to look at your own data and to propose and implement policies, strategies, actions in order to strengthen nursing. For our region, our key messages for based on this report results is that government should address the key issues that are impacting the recruitment and retention of nursing. In this way, we can ensure that the profession remains attractive and that health services delivery is not impacted by the nursing shortage. And then we need to value the nursing profession. We need to turn it to make it more attractive for the young people, for the future professionals. For sure, this will help address the shortage of personnel that we have in the region and will ensure a sustainable workforce. Then we need to ensure the proper working conditions for nurses. This is a key action to retain the nurses. It's essential to ensure to invest in policies and programs that ensure nurses' well-being and mental health. And then the last key message is that we need the nursing participation in the development and implementation of the health policies in order to foster their feasibility, their effectiveness, and the sustainability of the health interventions. So this will support in order to do that. In order to facilitate the participation of nurses in the development and implementation of health policies, we need to develop their competencies, their capacity, and their autonomy in this position. So finally, I would like to invite you all to attend the PAHO event celebrating the International Nurses Day that will be tomorrow at 2 p.m. Washington, D.C. time. On this occasion, we will have distinguished panelists. We will launch some products, some PAHO products. So join PAHO in celebrating the International Nurses Day. We do believe that by investing in nursing, we can transform realities. We can build a more equitable and healthier society. So together we can strengthen nurses. Thank you all for your attention and happy International Nurses Day.
Thank you so much, Dr. Moreno, for those powerful insights into the report. And one of the most things I would have taken from your presentation was 31% have wellness and mental health programs for health personnel. And I believe that that should be 100% and not 31%. So that is definitely something that can be a key takeaway from the presentation, because if we do not develop our workforce, then what would happen to the state of nursing. So thank you so much, Dr. Moreno, so much for that insight. So we are now going to move on to our expert panelists. We have 4 distinguished leaders here amongst us who will share their reflections on how we can translate these findings into real world progress. But before we go into that, I want to highlight one very special person who I'm very thankful to see here this morning, good afternoon, whatever time it is where you are. And that is Nursing Now Challenge Associate Jason Gilbert. It is an honor to have you here in our session today. And if you do have some time with us, I will give you that moment to speak. Thank you so much. So our first speaker, Valarie Francis Miller, former president of the National Nurses Association of Barbados. Over to you, Valarie.
Good day to everyone, to the panelists, to all nurses. A blessed good day to you all, and happy Nurses Day. It is both an honor and privilege to be a part of this virtual conversation on the future of nursing in the Americas, leading to inspire and ignite. I want to thank the organizers for this webinar and extend my heartfelt appreciation to the global nursing community, our colleagues, leaders, administrators, educators, and advocates who continue to shape and strengthen the healthcare systems across the Americas and beyond. The newly released 2025 State of the World Nursing Report presents not only the most up-to-date picture of our workforce, but also a powerful call to action. It reflects the resilience, complexity, and potential of the nursing profession in a world still healing from the disruption of the COVID-19 pandemic, economic instability, and health systems disparity. We now have clearer, more precise data on nursing education, employment, regulation, migration, and of course, leadership. We see that while the global nursing workforce exceeds 28 million, severe regional imbalances persist. The Americans, for example, exhibit some of the highest maldistribution, burnout, and systems inequalities that restrict the full impact of nurses that nurses can have. The projections to 2030 in this report are both a warning and a blueprint. If we do not act with urgency and intent, our healthcare systems risk becoming even more strained. But if we invest strategically, I want to repeat that. But if we invest strategically in nursing education, in retention strategies, in safe working conditions, and leadership development, we can close and bridge the gap. As we look ahead, there are three pillars I believe must guide our work. Number one, first, leadership must no longer be just an aspiration. It must be an expectation. Nurses at all levels should be empowered to lead not just in the clinical area, but in health policy, education, and research. We must build pathways that elevate nursing leaders who represent the diversity of the populations we serve. Secondly, equality in education and employment must be our compass. Too many talented individuals are locked out of nursing education because of socioeconomic and geographic barriers. We must scale up access to high quality cultural responsive training programs and ensure fair and decent work for all nurses, regardless of their setting. Thirdly, international corporations must be strengthened, not just managed. Migration continues to shape the nursing landscape in the Americas, but we must move beyond a short-term fix. Bilateral agreements, ethical recruitment practices, and investment in source countries must become standard practice, not an afterthought. Let us also remember that data is only powerful when it leads to change. The evidence in the 2025 State of the World Nursing Report must drive us from insight to implementation. It should guide policy decisions, funding priorities, and workforce challenges, not only at the national level, but also at the local, community, and even the household levels. The future of nursing is not just about addressing shortages. It is about redefining what nursing can and should be in the 21st century. Nurses are innovators. We are problem solvers. We are connectors between health systems and communities. We lead with clarity, compassion, and collaboration. We not only care for patients, we shape the future of public health. So today, I want to challenge all of us to rise together with courage, with vision, and with unity, because the future of nursing depends on the actions we take right now. Thank you very much.
Thank you so much, Valarie, for those words. I must say that making a note of your three pillars was very, very instrumental to me just now. Nurses leading in key areas that elevate the nursing profession, asking for equality in employment and education, and having international involvement. And today, from your presentation, I will say our call to action is from insight to implementation. Thank you so much once again for your presentation. Very well said. We will then move on to our next speaker, Felipe Cortez Leddy, National Director of Nursing, Ministry of Health of Chile. Felipe?
Thank you, Tracy. Good morning, everyone. Happy Nurses Day. It's a real pleasure to be with all of you celebrating this day. And of course, in terms of reviewing the State of the World's Nursing 2025, we are gathered at this pivotal moment for the global nursing profession. This State of the World's Nursing 2025 report brings both hope and a sense of urgency. While we celebrate, of course, our progress, persistent gaps remind us that much work remains. The global nursing workforce is growing, as we all know, and is projected to reach 36 million by 2030. Yet this growth is uneven, most visible in high-income countries like regions like Africa and the Middle East continue to face severe shortages that threaten public health. But there is also opportunity. The majority of the world's nurses are under 35 years old. So this represents not just a statistic, but a promise. A new generation ready to lead, to innovate, and transform care. That's very, very important. Investing in their education, in mental health as a priority in this era of artificial intelligence and multi-communication, and of course, leadership is not optional, it's essential for every level. Disparities in training and safe working conditions still hold us back. Many countries report having chief nursing officers, like is my case. Yet leadership opportunities must expand, not only in these roles, but in more general and consistent basis, especially for women. We must remember that nursing is a primarily profession and discipline led by women. And of course, nurses in low resource settings. And while we have learned powerful lessons from the pandemic, translating them into real and concrete policies and protections is now our collective responsibility. In the case of Chile, which is the farthest country in the world, is the end of the world, I say in many places, we stand, and not because I'm saying this, okay? I want just to clarify that. It stands as an example of progress led from within, with over 86,000 registered nurses and a strong presence in public health. Our country is moving forward. We have formally recognized key specialties, launched a national licensing exam, and strengthened collaborations between the academia and service. But of course, all the challenges remain. We still face workforce shortages, gaps in protections, recognize all the work that women always do, not only as professionals, but as mothers, as people who lead the discipline. And the urgent need to expand advanced practice roles is a real challenge to face. All this population pyramid, we have a very old population with many diseases, and we have to face all this reality, all this health reality nowadays. But we're acting with determination, vision, and consistency. We have to say that at least. And from the National Directorate of Nursing and the Ministry of Health here in Chile, in partnership with other areas of the ministry and organizations, we are shaping an integrated model of nursing care related with the population needs. We recognize in this case that nursing is not only the largest health profession in our system, but it is a strategic force. So today, the message that I want to express to you is really clear. We need to engage, we need to connect, we need to empower ourselves and other generations of leaders, and we need to act as a whole region. To the new generation, this is your time, so step forward, lead boldly, advocate fiercely, because your voice is not only the future, it is the present. And as I always say, together, we are the voice and the force behind stronger health systems. And together, we shape the future of global health. So thank you very much. I'm always with all the openness to collaborate with you, and I'm very pleased to be here sharing with you this special day. Thank you very much.
Thank you so much, Felipe. I honestly cannot agree with you more. Based on my points, investing in education is key, because if we do not have the same level of standards throughout the region, then there becomes a lack in terms of how the performance of the nurse goes, in terms of even if they migrate. And also to have leadership at every level, especially for young early career nurses, is key, because the young nurses are now the driving force, the persons who continue to have that avid energy to continue to drive the nursing profession. So thank you so much for your presentation. Well said. Okay, so we will now move on to our next speaker. And remember, if you have any questions, feel free to put them in the chat box. We will have a few moments for questions and answers later on in the presentation. So our next speaker, Dr. Antonia Valarie, I hope I'm pronouncing your last name correctly, Dean, University of Pennsylvania, and Director of the WHO Collaborating Center for Nursing and Midwifery Leadership. Dr. Valarie, the floor is open for you.
Great, thank you, and happy Nurses Day to everybody. What a way to celebrate by the release of the State of the World Nursing Report. I want to share with you a few things that we're doing at the school, and also as director of our WHO Collaborating Center on Nursing and Leadership, and to talk about what the next steps are for us and for us in the region as well. At Penn, we are leaders in research, education, practice, policy in many areas outlined in the State of the World Nursing Report. For example, we've developed nurse-led models of care for vulnerable populations, for elders, for chronic illness management, and community-based interventions. We have been leaders in the preparation of advanced practice nurses to work in underserved area. We've been leading the use of technology and AI tools in community-based settings, and we have absolutely been leaders across the globe in creating safe environments for nursing practice, both at home, both in the hospital and in communities. And our faculty, Sarah Kagan, has created an educational initiative, which I know has taken off in Latin America, that has included students from all over the world and all over Latin America to address the issues of climate change. As director of the WHO Collaborating Center on Nursing and Midwifery Leadership, our colleague, Dr. Eileen Lake, has been working with countries in the English-speaking Caribbean countries to assess and evaluate the nurse working environment. What's unique about this initiative is that we have worked in a different way in our PAHO region, enlisting the support of PAHO and Ministries of Health to deploy the survey and hopefully to take needed action. In our collaborating center, we've also focused on capacity building for nurses and adolescent health, and also advancing PhD education, which Bruna highlighted, again, the huge disparity in the regions, so that we can identify synergies and areas of collaboration. I will say that the Nursing World Report is not only action that nurses need to take. In fact, I would say probably there's not a whole lot of new news in this report. There is, however, evidence. And what I tell you what we need in order to develop sustainable and impactful action, there needs to be requisite policy changes that nurses lead. First of all, we have the evidence. It was provided in the State of the World Nursing Report. We have much of the data on any of these particulars in our university and within our WHO collaborating centers. We have the social strategies. We know what needs to be changed. We know how it needs to be changed. We've provided evidence of how it needs to be changed. We've done this within our universities, in the regions, within our practice settings, within our PANMAC group, and in partnership with PAHO. What we need is the political will. And again, not just from nurses. We need WHO, PAHO to join us in advocating at the country level and between countries for implementation to address the disparities, the issues that were outlined in the report. Of course, we need money, but this is more than just funding. We need leadership within PAHO and WHO to champion needed action. Everything in the report, everything touches nurses, and nurses are, if deployed correctly, can address the issues, the health issues in our region. We need nursing leadership throughout. And again, as I said, this is not just a nursing issue, but the health of our countries and our region and depend on it. So my hope for this Nurses Day is that this report can serve as a springboard, not only as a call to action among nurses, but a way to elevate the work that we do and to make sure that it gets into policy areas in our country and within the region. And we stand by within our collaborating center and as a university prepared to help move those forward. So thank you. Look forward to working with all of you.
Thank you so much, Dr. Valarie. And I must say, I totally agree with you where you spoke about the advancement of the PhD education and making sure that we create those synergies, because as you said, we have the data, we have the evidence, we have the social strategies. So right now, the call to action is to invest more at the policy level. Thank you so much once again. So we will now go on to our next speaker, Dr. Oscar Noel Ocho, Director of WHO Collaborating Center in Nursing Policies and Leadership, University of the West Indies, Trinidad and Tobago. Dr. Ocho, the floor is yours.
Thank you so much for this kind introduction, Tracy, and to my other colleagues who would have gone before. And I really appreciate the opportunity to represent, along with my colleague, Dr. Valarie, the PAHO WHO Collaborating Centers of the Americas. But I also think that it's also very critical for us to put in context, and I'm speaking here from the Caribbean perspective, because the report speaks to key messages along key areas of leadership and education and jobs and service. And while they are extremely important and they form the pendulum upon which we are looking at repositioning nurses to lead and inspire, some of the key realities that we have to contend with, even as a Caribbean region and Latin America. And the report continues to speak to the whole issue of migration and its implications. And while we continue to train individuals, within the context of this region, bearing in mind our unique needs as peoples in the region, the reality, the political and socioeconomic climate does not allow governments in the region to give the same levels of terms and conditions of service as the metropolis. So as a consequence, we continue to experience the problem of brain drain. And as a result, there are greater levels of potential for younger and inexperienced nurses to assume positions of leadership, even at the policy level. And commensurate with that is that you may have an individual who will be in a position of authority, but may not be able to attract a certain level of respect, bearing in mind we are speaking about this profession that is female dominated. And therefore, one of the key things that we have been doing, even as a collaborating center, is looking at how can we as academic institutions develop core competencies among our nursing leaders, because very often they are functioning in a policy context, but they don't have the requisite level of understanding of the policy framework. So they may sit at the table, but in the absence of having exposure through education, training, and continuous professional development and academic development, their contribution will not be as valued. And therefore, we see this as critical to our role as nursing leaders. But what is also key is that there is an absence of clearly structured and deliberate processes for data management. What the state of the world nursing has done, it has provided us with a framework of the importance of us ensuring that our data is consistent and it's of a standard that is quality. And therefore, one of the things that is key, and take, for example, we have been speaking to, coming out of a study that was done in the region, looking at the whole issue of migration, the quality of the data is very limited. And if we are to make informed deliberations and informed discussions, it means that we must have well-structured and comprehensive data sets through which we could be informed. It's also very critical that one of the actions that we have been undertaking as a collaborating center is working with the Ministry of Health in Trinidad and Tobago in looking at developing the scope of practice for nursing personnel, looking at standards, looking at the core competencies, and looking at the key performance indicators. In so doing, we can now look at ensuring that if we are talking about leadership from the early up to the policy level, there will be a clear framework from which we can be able to function. But I also think that what this State of the World's Nursing Report has done is that it has shown us the importance of the tripartite approach to decision making. And therefore, as nursing personnel, whether it's at the policy level, at the ministry, or at the education level, whether it is at the professional level, and we are talking about the professional associations, or whether it's at the regulatory level, looking at the councils, it's important that we cannot afford to continue to function in silos, but we have to function as a collective, because at the end of the day, it is the collective that will inform the requisite levels of human resource so that we could look at the training, we could look at the jobs, we could look at the service. And the final thing I want to mention as we look at going forward is the importance of ensuring that as we look to creating spaces for leaders, that countries not only look at replacement planning, but look at a strong systematic approach to succession planning so that we can be sure that it's the right persons with the requisite levels of competence who are able to assume positions of leadership. And here, this report allows us as collaborating centers to continue our work in the region in supporting academic institutions and governments in ensuring that we develop our nurses who would be able to lead unitedly to inspire. Thank you.
Thank you so much, Dr. Otto, for bringing more context of the Caribbean to our webinar this morning, especially making note of the migration and its implications, especially of that of the brain drain. And that is something too that I have been researching as well from a Caribbean standpoint, and understanding the need for policy framework, not only as a professional, at a professional level, but also that of having the young nurses involved in working together and also working and functioning as a collective throughout the Caribbean. Thank you so much once again for your presentation. I just want to take this time to thank our esteemed panelists for their leadership and insight this morning. We will now hear from the next generation. So please join me as I welcome George Chalice Williams, a registered nurse from Mexico, who will share his lived experience as an early career nurse. Just give me one moment, as he will be speaking in his native language of Spanish, and you can follow along in the captions below.
Hello, nurses from Americas. This is a pleasure to be here with all. I can speak in English, and it's okay for me. So I can begin my presentation. So today is not just a day of celebration. Today is a day to speak clearly, boldly, and with dignity, because situation remains critical for nurses. In Mexico, dozens of nurses are tired of unfair conditions or wages that do not reflect their effort, of exhausting shifts, of a lack of real recognition. It's not a lack of vocation, it's a lack of justice. The dignification of nursing work can no longer be postponed. And at the same time, students, the future of profession, are also waiting for something more. They need a system that supports them, that trains them, that listens them. We cannot keep teaching under the hegemonic medical model, which reduces health to the sea and to do orders of a single actor. We need a model that empowers, that shapes critical, compassionate nurses who are ready to lead and transform. Because yes, medical care is important, but collective care is even more important. And that requires a different perspective. We need more nurses in key position within the health systems, but not just any nurse. We need nurses who think beyond the clinical setting, nurses who work not only to reduce the burden disease, but to build the condition for dignified life. Nurses who understand that health doesn't begin in a hospital, it's begin in the neighborhood, in schools, in transportation, in access to food, in housing, in justice. That can only happen through intersector and work, through nurses leading public policy, making a strategic decision, defending the right to health with a collective, integrated, and to community-based approach. We cannot wait any longer. This is not just about commemorating, it's about taking action, about demanding the change we all know are necessary, about raising our voices for those who care, those who teach, and those who learn, about building in health systems that doesn't just treat illness, but creates well-being. The transformation starts today. It starts with us. It starts with you, and we will not stop. I am a registered nurse. I have a master in public health in Mexico. And I think that nursing students are the future of the nursing, but we need to empower these nursing students. We need to invest of nursing students. And I think that it's important not only commemorating this date, it's necessary to take action. Now, we can win more. So thank you so much for this opportunity.
Gracias, George. Thank you so much for your courage and authenticity this morning. And I can tell you, your voice has definitely been heard. And demanding the change, I agree. We are demanding that change. We are bringing this call to action today and onwards, especially with your point of having the collective, health initiatives in leading to the public policy. Thank you so much. So, before we go into our question and answer segment, I would kindly ask if Nursing Now associate Jason Gilbert can give us a word.
Thank you, Tracy. So I don't know if I have anything to add from anything that my esteemed colleagues said. They've all said it very well, but I think that if you are sitting on the webinar thinking, where do I start with this? Because as we all know, it can be overwhelming of where I start. I would encourage everyone to read the report. As was said, that is the evidence that we need to craft our message for how we go about this. And I would encourage everyone to really think globally, but act locally. Sometimes those small changes in your community or in your area really have that ripple effect. And I think collaboration like this across the globe is vitally important as we think about how we're going to reshape the nursing workforce of the future. So you all are very inspiring, and thank you for the time.
Thank you so much for your words. Stephanie O'Neill is one of the challenge leads here. And at this point in time, I will give the floor over to her as we will then moderate the question and answer segment.
Hi, everyone, and thank you, Tracy, for that wonderful introduction. We are so lucky to have you moderating this wonderful session with all of these amazing nurse leaders. Tracy, you are phenomenal, and your energy is palpable in this Zoom room and around the world globally. So let us begin our Q&A. I do see one question, and it is from Othman Jory. So Othman Jory from Tanzania. Forgive me if I mispronounce anything. You can unmute and pronounce it yourself. It states, I wish if it were possible to visit different countries and see how they work and share some ideas so that we can bring that knowledge we acquired to our countries. How can you, as our community, help us achieve this? Thank you so much for this wonderful question, and I leave it up to our many panelists to answer if you can.
If I can respond, I think
Yes,
one of the
please.
first things that has to be considered is what is the nature of the visit that is being considered. Because if it's a visit that is social or cultural in nature, that will be personal. If it's a visit that is rooted in seeking an alignment or an attachment to an academic institution, or even at the policy level, then each of the specific countries or institutions will have its own policy framework. So I think the first thing that has to be done is, one, determine what is the nature of the visit, and then try and reach out to either an academic institution or the policy institution within that country, so that you can be guided as to what will be the steps and the framework to facilitate such a visit.
Thank you so much for that thoughtful response, Oscar. We are so lucky to have you part of our panel, and it is just pure brilliance every time that you speak. And we are so lucky. Thank you so, so much. I hope that answers your question, Othman. We have one of our experts in the room, and we are honored to have them. I also would like to see if there's any other questions in interest of time, because it is 12:33. I know we are a bit over the hour, and I'm sure that we can have this webinar go for several hours. Do we have any other questions before moving to our closing remarks? I'm just checking the chat.
I would just like to add something that Oscar mentioned, that we're living in this era of technology, and we have an immense opportunity to create spaces of co-working and to know what is doing this or that country, and make this all this union that in terms of public policies, how are we advancing in terms of different strategies, and how can we build community? I know there's a huge community, but how can we know each other, and how can we connect on a daily basis to be more in touch? You know, it's so rich. This very small space of time can open a full range of possibilities. So the invitation for me is to use these resources to increase and strengthen this community.
That was amazing and so well said. I don't think I could have ever said better myself. Thank you so much for your amazing and brilliant insight, Felipe. We are so lucky to have you here today and in our nursing community to back us up and support us. You are such a strong advocate. Thank you. Wow. We are so lucky. I would be remiss if I just want to ask one more time, any other questions to our amazing panelists, and then we will go to our closing remarks. Anything. I don't see anything yet, but of course, we can try to see what we can do. But it is my honor and privilege to introduce to you for closing remarks, Dr. Rhoda Redulla. She is our magnet program director of New York-Presbyterian, the entire enterprise of magnet and excellence. She wears many hats, by the way. She is also the faculty for Yale's Doctor on Nursing Practice and the associate editor for gastroenterology of Nursing Journal. It is my honor and privilege again to introduce to you Dr. Rhoda Redulla.
Thank you so much, Stephanie, Tracy, and our esteemed panelists and our Challengers Committee. Happy International Nurses Day. And wow, like this is the most important report, period, that every nurse has to read. And it is really apparent in the report that nursing remains to be the largest occupational group in the health workforce. And when Tracy was asking us, put a word in the chat box, and there were so many words, of course, that were coming into mind, but one thing that came up really is like power. We have the power, and that theme came up in the discussions and in the presentations from our panelists today, that we are the voice towards a strong, healthy workforce. I think, Felipe, I heard you say that, and you couldn't have said it better. And aligned with the theory of change that, if you all recall, that Dr. Carrie McCarthy previously presented, that this new evidence will really drive the dialogue, the decision-making, with the aim of sustainable development in nursing locally, regionally, and globally. And the challenges affecting health systems and well-being continue to rapidly increase. And I often think, Stephanie introduced me for my role right now in the United States, but when I speak here at Nursing Now, or when I look at global reports like this, I often think that I have a unique lens reflecting on many aspects of the reports. I'm a Filipino American, and I started my career in the Philippines, and I received my basic nursing education, even my master's education in the Philippines, but now have spent a greater part of my journey here in the United States. But in the Philippines, as a student nurse, I had that experience receiving didactic and clinical experiences in acute care setting. I remember going to the communities and really actually delivering primary care as a nursing student. And before my family moved here in the United States, I was a faculty member there. So there's a lot of interconnectedness, but I also speak to you with this deep appreciation of our profession and also about this empirical data in the report, right? And I can say that there's so much already that has been done, but we still have work to do. And the three themes that I would like to hone in today, and we are a very large region in the Americas, but I will share with you some of these experiences from a standpoint of me having led academic medical centers in the Magnet Recognition Program, which is the gold standard of nursing excellence. So now that leads me to say that, yes, there's so much work to do, and there's so, we have a lot of steps to take, but this can be done, right? With appropriate support. This can be done and with appropriate synergy. So the three themes that I will share with you is the support for professional development. And I think a key area there is supporting transition to practice. And we've heard a lot of those themes today. Particularly for me, early career nurses, right? There's increased demand for support in transition to practice, and we have models and best practices that we have seen when there is structured transition to practice programs. Like here in the United States, we have nurse residency programs where nurses are supported to have better role confidence, role satisfaction, and it shows to have support for them in the stress, burnout, and resilience areas, but having that organizational commitment. Also, having successful secondary outreach programs in the high schools, really showcasing the image of nursing. And on that note, again, a key area that we need to continue to work on is to attract more individuals to enter nursing, which may sound like a cliche some days, right? But it is so important, showcasing the competence and expertise of nurses, which includes educating the public over their diverse roles. I'm not sure if you have read the book From Silence to Voice, what nurses need to communicate to the public. This book was written by two journalists, and this book was written from the lens of two individuals who have had so many interactions with nursing, but they then identified that we need to be able to communicate all the great work, our value in various forums. And this is why they have very specific advice on how to engage with the public, some very practical advice like, if you're in an elevator and they ask you, what do you do? So do you say, I'm a nurse? And no, there's so much more that you can say in that 1 minute elevator ride, right? So a lot of those things, and improving the image of nursing, and really professional development, right? Developing the professional brand, which allows nurses to share their unique story and expertise with the public. And leaders need to create that environment so that can happen. And this is through encouraging involvement in professional organizations. And one critical thought that I have right now is this report needs to be communicated with every nursing professional organization, but maybe even remove nursing, right? Who are our collaborators? Professional organizations will need to know about the report. In my editor role, I was already thinking to bring this report to our editors group, because we need to be writing editorials about this. We need to be writing articles about the report. So that's just one. And then one key area too is leadership development. And one thing that really that I noticed in the report is that, yes, while in the Americas, we are at par with other regions in terms of having CNO positions, but the nursing leadership development programs, there is huge disparity. So when I look at our theme right now, engage, empower, and act, as an Americas region, yes, we have work to do, but we are also compelled to support all of our peers, right? Our other peers in other regions, to be able to bring this leadership development programs to them and move forward. And we have, once again, we have very structured programs to be able to do this. And lastly, it is policy. So a lot of this work cannot happen without nurses having a voice in policy. And the more that we are communicating about this and creating the platforms for nurses to be able to communicate, then we will hopefully get there. And I really look forward for us to the words of I believe it was Oscar who said, we are the pendulum that repositions nursing into this place of being able to change healthcare and advance healthcare. And with that, I know we are out of time, but we we definitely have that influence as a region in the Americas to be able to do this work. Thank you.
Thank you so much, Dr. Rhoda Redulla. We are so honored to have you close us out, and you have certainly taken us home. And I would like to also acknowledge Angela. I think you really summed us really well in the chart. She said, let's not just count nurses, but make the nursing voice count. And I just want to thank all of our panelists as well as we continue to protect, direct, and connect our nurses and midwives and think globally and act locally. Just trying to sum up what our amazing panelist has said with us today. And of course, our amazing moderator and one of my esteemed colleagues, Tracy Collins. Please, if you can say a few words to close us out. We are so honored to have you moderate our session and webinar today.
Thank you so much, Stephanie. It was my pleasure to be here as moderator for you today. And as you said, I just wanted to take this time to thank all of our esteemed panelists for taking the time out to be here with us, celebrating on this International Nurses Day. And just to take away that today is the day that we engage, we empower, and we act, because the future of nursing in the Americas depends on us through leading, to inspire, and unite. With that being said, this now concludes our webinar for today. And once again, thank you so much to everyone, including our audience, for being so interactive. And thank you once again. So I hope you guys have a great
Thank
day.
you, everyone.
All right, bye, everyone.
Thank you.